Lauren, thank you. Now to that big announcement from the FDA, a third COVID-19 vaccine dose could soon be available for anyone who is immunocompromised. But there are still a lot of questions about how this is going to work.
Yes, Suzanne Bruner joins us live in our WFAA newsroom. Suzanne, who is eligible for this booster shot?
It's going to be eligible for certain people, Tashara. So the FDA says people with severely weakened immune systems are eligible for that third dose of COVID-19 vaccine. So who is eligible? Transplant patients, people on chemotherapy, and those who take medications that suppress immune system. Now, Americans who fall in this high-risk group is roughly 3% of U.S. adults, and that's several million Americans. But one thing that you need to keep in mind here, that extra dose has to be from Pfizer or Moderna. Also, you have to get it at least 28 days after receiving that second shot. The FDA made no mention of certain immune-compromised individuals who received a single dose of the Johnson & Johnson vaccine. But I know many of you have asked when and if you can get that booster shot. Well, this has not been okayed for the general population right now. And officials, they are actually still monitoring this, saying the vaccines continue to be effective, they're working, and they are offering robust protection.
These are for people who almost certainly did not get an adequate response to properly protect them in the first place.
So the CDC advisory panel is expected to meet today to formally recommend that extra booster shot for certain immune-compromised groups. But right now, I'd like to bring in Sonia, who has been following the latest developments on this booster shot for weeks now, Sonia, and there's been a lot of questions surrounding this. What are you hearing?
Well, a lot of questions about process right now, of course, right? So, and these are questions we do not have answers to just yet. So let's say that the ACIP, the CDC advisory panel, says, okay, we're going to go ahead and recommend these booster shots, and they're only the mRNA vaccines, as Suzanne mentioned, right? What is the process? If I am receiving cancer treatment, do I go to my oncologist and say, okay, now I need the booster shot? Where do you get it? Is there a process in place? And the answer is no, right? So there are a lot of questions that we're going to have to be patient and kind of sift through, wait through. And I think that one of the questions also that I wanted to bring up is, how are you going to prove that you have a chronic condition or that you are immune compromised when you show up to receive this booster? So a lot of questions for me personally as a health journalist, and I know that this is also on the minds of people who it'll affect. So of course, we're going to be asking these questions throughout the day of our experts, and we'll continue to push until we get the answers for you. Meantime, as we see cases of the Delta variant rise, the battle over masks really is ramping up. As you know, this morning, the city of Denton waking up under a new mandate. So Denton folks, grab that mask. Meanwhile, all of this is going to play out in court. Chris Sadeghi joining us live now. And Chris, Dallas County really is at the center of a legal battle over all of this.
Yes, Sonia, because as he's been throughout the pandemic, it's County Judge Clay Jenkins who is at odds with Governor Greg Abbott. And last night, Jenkins received some company, two very different types of company. This is the kind he did not want to see, a group of about 75 people showing up in front of his house to protest the Dallas County Judge's emergency order that put mask mandates back in effect for indoor public places. Jenkins' order was made possible by a district judge who granted a temporary restraining order on Governor Abbott's mask mandate ban. But Jenkins now also has some company that's joining alongside him, namely the city of Denton. Their city council voted in an emergency meeting last night to follow Dallas County's lead and put a mask mandate back in place for all businesses, schools, and city buildings. It was a 5-2 vote in favor of the mandate that took effect at midnight. But Abbott is already challenging that restraining order. And if the Court of Appeals rules in favor of Abbott, these mask mandates could get lifted right away. Jenkins spoke to ABC about why he thinks the law is on his side.
Well, the law in Texas gives the governor the right to suspend certain regulatory laws, like licensing out-of-state nurses to come in and help in a public health emergency. It doesn't give him the right to stop a public health response. What the governor has tried to do is say no one can respond to this emergency through vaccine requirements or mask requirements.
And we expect the Court of Appeals to make a ruling on that restraining order sometime in the next couple of weeks. Sonia, back to you.
Chris, thank you. And last night, the largest school district in Texas voted to make masks a requirement on campus. The Houston Independent School District School Board unanimously approved that new mandate. Locally, our two biggest school districts, Dallas and Fort Worth ISDs, will also require masks. We've got a guide for you on WFAA.com under the Back to School tab.
Time now 6:08 this morning. It is time for your morning rush. COVID-19 hospitalizations in North Texas surpassed 2,500 this week, putting a strain on both capacity as well as staff. Intensive care units are reaching their limit at several large hospitals in the region. UT Southwestern has only 1% available. Texas Health Arlington Memorial, none. There are virtually no pediatric ICU beds left in our region. Most all patients are unvaccinated. Here's one way to encourage teachers to get their COVID vaccine. Offer them a bonus. Dallas ISD will give any district employee a one-time incentive of $500 if they are fully vaccinated. They just have to fill out a form and submit proof by November 15th. The money will show up in their paychecks.